Morning. Thanks, Jess, and good morning and welcome to everybody. If you can go to the next slide, Kush. For those of you who haven't joined us before, this is your first time with us, this learning series is really an opportunity for us to learn together, to learn from experts, to strengthen our collaborative muscle, to build our capacity for implementation and for engagement with communities, ensure our work includes a through line of equity, and that we prioritize our resources as far upstream as possible. We are really trying to build a community of practice through these learning series so that we can advance a transformative approach to child welfare. Next slide. I'm incredibly excited about today's topic. As you can see, it's a part 1 of 2. And I think it gets to the heart of what is necessary to transform our current child welfare system. A system that bends towards justice and equality, and one that centers families, children, community, and their well-being. The promise of Family First Prevention Services Act is that there is a shift in our collective thinking and belief about our ability to support children and families in ways that keep them safely together. Believing in the promise of California, the Department of Social Services invested $200 million in California counties to create a comprehensive prevention plan to include primary and secondary prevention strategies so that we can strengthen communities and families can thrive. Essential to California's approved Family First Prevention Services Plan is the inclusion of a community pathway strategy. It is a strategy that is rooted in California's vision for child, family, and community well-being, which is centered on equity, social justice, and respect for tribal sovereignty. Recently, the Prevention and Early Intervention Committee of California's Child Welfare Council made and received approval of a set of recommendations to strengthen the development, oversight, and sustainability of local community pathways and ensure that the community pathway is a key component to safely narrowing the front door to child welfare. Today's learning forum will focus on the importance of key features of a community pathway and highlight strategies for pathway development being employed by our child welfare colleagues across the country. Next slide. Each of our learning forums will start with an acknowledgement of our collective history as a step towards reconciliation and a constant reminder of our intentions, purpose, and goals for why we are coming together. In order to address centuries of collective harm and trauma to African American and tribal children and families, we must make an intentional choice to rebuild communities in an equitable manner. I acknowledge that I am sitting on the tribal territory of the Kahula people, who are the rightful owners of the land we now call the Coachella Valley. I also want to acknowledge and pay my respect to our African ancestors for the enslaved forced labor they had to endure for this country's development and economic progress. We highly encourage everyone to do their own research on these aspects of our history. And in the chat, there'll be a couple of links to help you do that. So today we have an incredible panel of presenters. First, we have Hillary Conrad, Bureau Chief of California's Office of Child Abuse Prevention. Prior to state service, Hillary provided direct services to families as a child welfare caseworker and worked for nonprofits and private entities in the human services industry. She is passionate about providing technical assistance to build a more integrated and collaborative prevention continuum of care. Next is my colleague from Casey, Nicole Yohalam, the Director of Knowledge Management. She brings years of experience in youth development and education at the local, state, and national level. As a member of Casey's knowledge management team, she researches and curates information and best practices from around the country to share with our country's child and family serving systems. Next is Jennifer O'Brien, who is a policy fellow at Chapin Hall at the University of Chicago. Jennifer provides implementation and capacity building assistance to multiple public and private child welfare agencies across the country. Dr. Krista Thomas is a policy fellow also at Chapin Hall. Thomas leads blended teams of policy, practice, and research experts in efforts to build the capacity of state and local human services systems across the country to execute large-scale reform initiatives and improve outcomes from children and families facing adversity. And finally, but not least, Dr. Kush Cooper. She has been our moderator throughout this series and will continue to do so. She is an adjunct professor at UCLA Luskin School of Public Affairs, as well as the CEO of Implematics, a consulting firm serving public and private organizations in the areas of foster care reform, LGBTQ, youth and systems, implementation science, and leadership development. Welcome to all of you, and Kush, I will turn it over to you.
Thank you, Dana. And before I go on, I want to acknowledge I am living and working on traditional, ancestral, and unceded territory of the Chumash, Gabrielino Tongva, and the Fernandino Tatavian peoples, who are the rightful owners of the land we now call the San Fernando Valley. And what I'm going to do before I turn it over to our presenters is just locate us where we are in the journey that is this learning series this year. So our previous learning forums have anchored us in primary prevention. And we are now working ourselves, so to speak, downstream. Primary prevention supports and interventions are largely structural in nature. They support communities. Secondary prevention strategies are those that prevent families who are at risk of child maltreatment or its recurrence from having formal system involvement or re-involvement. And I want to highlight that sometimes we forget about our children and families that have recently exited the system to reunification and will need prevention services to maintain in the community. Secondary prevention strategies can be aimed at those families as well. Your local primary prevention efforts will begin to gradually address the social determinants of health, begin to protect and strengthen families, begin to restore health to communities. And it's mostly targeting families who have not yet fallen prey to the risks currently present in their communities. There are, and there always will be, families who will become susceptible to the environmental risks inherent around them, despite our best primary prevention efforts, because risk and protection impact different folks differently. These families are going to require intervention, additional supports, often services to mitigate those risks and enhance protection in the face of those risks. Today's discussion about the community pathway is going to point to the distinction of community pathway as one that provides those families that will need additional supports and interventions with access to services, but with as little formal involvement as possible with public agencies. Instead of having to knock at the door of a public agency for services, now in a community pathway, trusted community-based supports and organizations become the preferred intermediary connection to assessment, referral, linkage, and service provision. And something to keep in mind when we're talking about a community pathway is that many of you are not starting from scratch. You've got existed diversion-oriented infrastructure, such as the pathways you built for differential response that you can leverage in building your community pathway. And I'd also like to add that we have been building community pathways for a long time. The discussion about FFPSA federally and FFPS in California has elevated the conversation, and so to speak, put capital C and capital P in front of community pathway, and it's become an item of discussion. And so we're now going to add this federal and state reform context to infrastructure likely many of you have begun to build or are aiming to build in the first place. So to give you some context on the community pathway as it's reflected in this new reform, I'm going to turn it over to Hillary Conrad, Bureau Chief of the Office of Child Abuse Prevention. Hillary, please go ahead.
Thanks, Kush, and thanks for having me here today. I'm excited to share with you California's vision of a community pathway and why the community pathway is so key to transforming how we are serving children and families and moving upstream to child, family, and community well-being. And it's also the model that we do have within our current state plan. Dana already mentioned that our FFPSA state plan was approved in April. I also want to mention that we did have 50 counties that opted in to comprehensive prevention planning, and Yurok and Karuk as well. In addition, we've had 5 comprehensive prevention plans that have been submitted to the state for review. So that's very exciting, and we are on our way. Dana already mentioned that California went beyond the federal FFPSA law to offer counties an opportunity to develop and implement a comprehensive prevention plan. This plan is to be developed with a cross-sector collaborative approach that includes engaging the community, tribes, individuals with lived expertise, and trusted partners that work with populations that are disproportionately represented in the child welfare system. As part of this comprehensive planning process in California, counties are encouraged to develop and implement a community pathway. Next slide, please. The vision of the community pathway is to create other access points for families to be reached, have their needs met sooner, and to benefit from Title 40 prevention services and other prevention services. We want to make sure we are honoring and building upon the trusting relationships that exist between community partners and children and families in order to increase engagement and access to services. California chose to include a community pathway in their plan because moving upstream is critical to an equity-centered approach, as studies have demonstrated that racial disparities occur at various decision points in the child welfare continuum. So reaching families before child welfare involvement decreases the number of decision points that likely cause these disparities. We want to expand services and increase access to reach families sooner so we can mitigate the trauma that is caused by involvement in the child welfare system. We are encouraging counties to think even bigger and create community pathways that serve more than just candidates at imminent risk of foster care, but also serve other children, parents, and families requesting services and that are at need. It is essential that community pathways are co-created with community members to ensure equitable and culturally appropriate, relevant, and responsive services. It's also essential to have agencies from both the public and private sectors working together to make this happen. The ultimate goal of the community pathway is to build protective factors and strengthen families to reduce the likelihood of child welfare involvement and prevent entries into foster care as well as re-entries into foster care.
Hillary, before we move on, we'd like to launch a poll for our audience. And that poll is going to ask you, given what, Hillary's just started talking about our CPP, or the Comprehensive Prevention Plan. Our poll is, have you submitted your CPP? Let's see. Going. And the second one some of you have started answering also is, does it contain a community pathway, whether you've submitted it or not? Right, most of you, give you a few more. We've got half of the folks who have answered. All right, I am going to go ahead and end our poll and share the results. So it looks like about half of you have not submitted it yet. About a third of you are uncertain, sort of if your jurisdiction or county or tribe has submitted one, and 17% of you said yes. And almost 40% of folks are electing to put a community pathway into their CPP. Wonderful. Thank you for contributing, those of you that did. All right, Hillary, back to you.
Okay, thanks, Kush. And that's great news. I'm glad to hear it. So on this slide, this is a visual of an example of a community pathway model. We understand that in each county, it's going to look different based on what the needs are of your community and based on what you're hearing from your community as well as trusted community partners. And as Kush mentioned earlier, we really want you to deliver services and leverage intake and assessment processes that already exist within your community. So I'm going to walk you through some steps that may be part of a community pathway model. The first step is really that first initial interaction with the family. And this is a no wrong door approach because this is setting up a referral process in your county so that families can have their needs met at a service provider that I'm going to be referring to as a coordinator of services. So this family could be self-referred, it could be a school that refers them, it could even be child welfare that the need did not result in an investigation, or at the hotline call, the call was evaluated out, and that family could be referred over to this coordinator for services. The service provider could be a family resource center, it could be a community-based provider, it could be a behavioral health agency. So the next step is, now that this family has engaged with this coordinator of services and the service provider, an intake worker completes an assessment to determine immediate needs and identifies if the child may be at imminent risk for foster care. If the child is identified as being possibly at imminent risk of foster care, then a referral is submitted to the Title IV agency or the county to determine whether or not they are eligible for candidacy. Since the county agency is peripheral and not directly involved, a unique case identifier is used when sharing information with the county agency. The third step is the county agency or the tribal Title IV agency reviews the request for authorization and determines whether or not this child and family are candidates. If they are, then authorization is sent back to the service provider, the coordinator of services, to begin prevention planning. And this candidacy determination then unlocks and authorizes the use of Title IV funds. Step 4, through further assessment, a child and family specific prevention plan is created to support their family and their well-being goals. And if known that the child has tribal affiliation, the service provider, the coordinator of services, would also partner with the tribe to develop the prevention plan, the service selection, and the coordination. Step 5 is now the agency's role, the coordinator of services role, to identify what are all the services within this prevention plan and who are the appropriate other service providers that we can coordinate with to make sure we ensure that this family is receiving all the services that are identified in the prevention plan. The coordinator of services agency also conducts case management services and possible coordination through multidisciplinary teaming services. They're also responsible for providing oversight and ensuring that the needs of the family are met. Step 6 is the delivery of services. So now we have a service plan. We know who all the agencies are that we need to work with. So the service providers that are delivering EBPs would deliver those services to model fidelity standards and communicate with other providers for the coordination of services under the oversight and monitoring of the county agency. And then finally, step 7 is oversight and safety monitoring, which is required by the federal law. So the coordinator and the other service providers will oversee progress of the prevention plan and monitor safety through consistent engagement practices, mandated reporting protocols, and safety planning. Service providers will be trained to monitor risk and safety, and this will be part of their contract with their county. The county then monitors administrative functions to ensure the deliverables of the contract are met and prevention plan efforts meet requirements. Next slide, please. And so then to wrap up, my next 2 slides are just pointing out what the key elements are to be included in a community pathway. So funding a community pathway starts with meeting the needs of the family. And then it's thinking about what are the funding streams that I can pull together in order to serve and address those needs. So we already have the Title IV funding and we have block grant funding, but that's really just the beginning. A successful community pathway is going to include multiple funding streams and will leverage other efforts such as interagency leadership teams and systems of care processes to determine what the best pathway would be for a county's community to ensure equitable access to services. Another key element in the community pathway is child-specific data. That's going to be included on the prevention plan. It's going to be when they were served, what services they received, how that progress happened of the prevention plan. That's going to be collected and shared with the county, but it's all going to be under a unique case identifier. And this ensures that the Title IV funds can be drawn down because we're meeting the federal reporting requirements. And next slide, please. And then finally, I just want to mention that community pathways may look different, but the end goal is really to increase the access to services for families and meet their needs sooner. So a pathway could be connected to differential response, or it could be a warm handoff for aftercare services after family reunification or adoption to prevent reentry or disruption. There's going to be a coordinator of services, and that's going to be the agency that the county contracts. And that coordinator of services is required to do the intake and assessment, the prevention planning, the case management, and then also monitoring safety and progress of the prevention plan. The service coordination may be in partnership with the tribe if that tribal affiliation is identified of the child. So I just want to quickly wrap it up. A robust community pathway will be co-designed with the community. It's going to be supported by multiple funding streams. It's going to be a coordinated approach, a partnership with tribes, and the result of the collaboration of public and private agencies working together to improve child, family, and community well-being. And so for more information, I believe they're going to drop in the chat a link to the Caltrend resource page that has a lot of, well, one has information about what's in our state plan and then also has additional resources related to the community pathway. And then I'm going to go ahead and drop in the chat the email box that we've been using to answer any questions that the field or stakeholders may have. And I just thank you for having me today. And I look forward to the rest of the presenters. Thanks, Kush.
Hillary, before we let you go, there are a few questions. And some of them you may not have answers to yet, but I just wanted to lift them up so you hear them, and those you can answer at this time, we can go ahead and answer. So there are a couple. One is around this unique ID that you talked about, the unique identifier. At this time, can you answer who generates this unique identifier, who the state intends to generate this unique identifier?
I do not know the answer to that question, but I can definitely take that back to leadership and loop back with them. I don't think we've fleshed out all those details yet, but that's a great question.
Right. And then there's just a few to just lift up around assessment. There's a question around if the state plans to provide an assessment tool that is going to assess risk and what the standards of assessment are going to be.
So at this point, the state is not going to be providing an assessment tool. We really want community-based providers to be leveraging what they've already been doing, and also assessment processes that families are familiar with. But we will be providing training as part of the community pathway curriculum that will include basically what to be looking for in that process.
Okay, so more to come on that, it sounds like. I think there is one more question, but I'm going to hold it. It might get answered a little later. Patty, if it doesn't, I'll make sure we come back to it at the end. But I have a feeling that some of the future presenters might answer a portion of it at least. All right, thank you, Hillary. Right. So I'm going to turn it over now to our colleague at Casey Family Programs to talk about philosophically why have a community pathway and what are some of the benefits for children, youth communities, and families of having this community pathway. I'm going to turn it over to Nicole Yohalam from Casey Family Programs. Nicole, please go ahead.
Thank you, Kush. It's great to be here, everybody, especially with folks who are working to make this concept a reality in the communities. It's so important. I feel like it's, I know you get mired in the challenges and the complexities, and they're real, and it's just, there's really no more important work to be doing right now, I feel like. So thank you for everything that you all are doing on this. My name is Nicole Yohalam, as Kush said. I'm joining you today from beautiful, sunny Seattle, which is the traditional land of the Coast Salish people, and specifically the Duwamish, Suquamish, and Muckleshoot people, past and present. First, if you want to go to the next slide, I just want to kind of clarify what we mean at Casey Family Programs when we say community pathways, and it's very consistent with what you've heard. Community pathways provide children, parents, and kin with access to culturally relevant local services without direct involvement with CPS. And I want to talk about three sort of caveats to this in the FFPSA context. First is that, as has been stated, FFPSA is not the only funding stream for community-based prevention services. You all have your state block grant, which is amazing. There's Title 4B. There's Medicaid, which hasn't come up a lot in our discussion so far, but there are multiple ways to fund these kinds of services. This process that you're embarking on of developing prevention plans is really about reorienting the system to focus on what families need, and then organize the funding architecture behind that, right? Rather than leading with, okay, here's a funding stream, here's all the parameters and limitations, and here's what we can do with that. So it's exciting to that you're starting from the place of what communities need and community strengths. Second, community pathways as they appear within, that's still on the last slide, sorry. These pathways are not the only mechanism for connecting families with supports upstream. So we've already heard about warm lines, family resource centers, differential response, mutual aid. So this is not the only way, and it's not a new idea. So not a silver bullet. FFPSA certainly has its limitations, but we do believe that the community pathways opportunity embedded within FFPSA is one very important tool in system transformation. And it's important because it gives you access to federal funding to build prevention infrastructure and to expand services. But I just want to acknowledge that this is happening in the context of lots of other really important efforts in California and elsewhere to get families the help that they need before they reach the front door of child welfare. Okay, next slide. I want to just hold up a couple of core, we're sort of zooming back out from where we were with Hillary, and then we'll get back into some of the details, I think, with our next presenter. But I want to hold up some core values or principles that undergird how we think about community pathways and that speak to the why. And I want you to try to hold some of these in mind as we go deep into the details. So the first is that all families need support at different times. That includes my family, it includes your family. This is not about just certain families over there who need stuff. We want to stay grounded, even though we're transitioning to the secondary prevention conversation. I feel like we should stay grounded in that primary prevention value of all families need support. That said, given the historic disinvestment in some communities, it's really critical that we develop robust pathways in neighborhoods that have been marginalized and where, as a result of that, there are deep inequities, both in terms of the community conditions and resource and access to resources. Acknowledging that structural racism is part of what has led us here is important, but that's not enough. We have to bring a very intentional race equity and tribal sovereignty lens to this work. Or, as we know from history, we run the risk of ending up with more of the same and perpetuating and exacerbating disproportionalities. And finally, just to underscore, this is about getting families the help they need without subjecting them to unnecessary surveillance and trauma. Next slide is a quote. I think it just drives home why this shift is so important. There are so many barriers to even knowing about or getting the support you need. You have to prove yourself worthy, and it's a very dehumanizing experience. When families are told they can have this, but not that, it keeps them down. It keeps them in poverty and prevents them from having what they need to care for their children. So again, this is about getting families the help they need and ultimately shrinking the child protection system. Okay, next slide. I think FFPSA gets talked about as in terms of a paradigm shift a lot. I think it's actually really more than one shift. I think it has the potential to reorient child welfare in several very fundamental ways, and it's easy to lose sight of these, I think, powerful shifts as we get mired in the complexities of implementation. But the first shift is in terms of the types of services offered. So we can now pay for prevention programming with Title IV-E rather than simply family separation and foster care. And that's a profound shift to an entitlement, and it's been a long time coming. Second, FFPSA broadens who can receive Title IV-E services, so we can now support services for candidates for foster care or children at risk, heightened risk of foster care and their parents and kin, rather than just children in foster care. And then third, it shifts how and where families can access services, so through community-based organizations rather than through the child protection system. And that's the shift that's really at the heart of this concept of community pathways. Okay, next slide. This is a strategy brief you all should have received prior to this event as a kind of a pre-reading. We developed it based on work that was going on in Connecticut, Indiana, and Washington, D.C. And at the time that we wrote this last fall or summer fall, these were the only states that had approved FFPSA plans that were they're getting started with their community pathways strategy implementation. So exciting to now be able to add some other places to this list. But to develop it, we talked with jurisdictional leaders in those three places last summer. We also were informed by two of our lived expert advisors, and we also partnered with Krista and some of her colleagues at Chapin Hall in developing this. So I will share this. There's a link to this brief on the resource page. I'm going to share a little bit about 5 of the lessons that lessons learned that these leaders wanted to share about early implementation of community pathways. And the first lesson learned is around engaging the community. You can go to the next slide. And we've heard a little bit about this already from Hillary and from Dana. The next slide, please. I want to quote a system leader from Connecticut that just described how important this is. We really listened to families. They need support. They want to be able to exhale and not feel like DCF is hovering. So we said, let's shift the experience families have of us and create a system that allows them to truly get the support that they need. So engaging the community is not just, can you go to the next slide for me, please? Not just about seeking input on this strategy or that strategy or this plan. It's about really listening, and we need to listen because we need to understand, right? Families are experts in what they need. They may not be experts in child welfare financing or data systems, but they are experts in what they need. And if we don't engage the community and understand the strengths and the needs of our families, then we really do run the risk of building services that miss the mark. And I want to distinguish between, with the second bullet, between sort of engagement of folks in planning and engagement, creating ongoing mechanisms for active partnership, because those are two different things. And in the brief, we talk about how, we talk a little bit about Connecticut's planning process for their FFPSA plan development. They did a nice job of community engagement that engagement started early. They offered lots of different opportunities for stakeholders to participate in that process. So it was a real mix of long-term work groups that folks could join, but also less time consuming and more individualized and even one-off avenues like focus groups and surveys. So lots of different ways to participate. And then each work group in their planning process was co-chaired by a DCF leader and a community partner. So it was very visible that this was a partnership and extended beyond the agency. And then in Washington, D.C., they also did involve lived experts in their developing their plan, but more useful in making this point is that the infrastructure they have for ongoing engagement. So they have in DC 5 community collaboratives that serve as their regional hubs. You use the coordination term, but they use regional hubs for prevention programming. And those were developed long before FFPSA in 2012. And each of those community collaboratives has a community board of directors, and they hold regular neighborhood meetings and events to be constantly learning from the community. And they have these feedback loops built in so that every collaborative is offering a different array of services and an evolving array of services that are very targeted to the wards that they serve. This is going to take, I don't want to suggest that this is easy in any way, and doing this well will require capacity building, very likely. Capacity building both at the agency in terms of staff readiness to partner and co-design with folks with lived expertise. And we also need to support community agencies and lived experts themselves to ensure that they have the scaffolding and the support that they need to engage with the agency. Systems sometimes do one of those or the other, but not both very well. This graphic here, I'm not going to go into it deeply. There are lots of resources devoted just to this topic, and actually one of the briefs we've shared in the resource list is based on this 4-part graphic. But I think doing this work authentically really requires making it a priority, and that means addressing all the barriers to engagement. It means slowing down and building trust and building relationship and doing all of this community engagement work with the trauma-informed lens. It means making sure people have access to the information that they're going to need and the tools they need to really collaborate. And it means sharing power. So that means us being much more transparent than we may typically be and unlearning certain practices and behaviors and creating different roles and different decision-making structures. So there's a lot of work to do on this. Okay, let's go to the next slide. The second lesson learned that we talk about in the brief is around candidacy and identifying families that need support. So FFPSA talks about candidates for prevention services as families that have experienced trauma and have children who are at imminent risk of entering foster care. And they've actually left the specific definitions of candidacy and of imminent risk to states and tribes. And the feds have actually gotten more flexible about this over time in the past several months. And there's some new guidance we'll share in the chat that really clarifies that this is up to states and tribes to define. The 3 jurisdictions that we talk about in the brief approach candidacy for community pathways differently. I'd say Connecticut, Indiana in particular took a very expansive approach, and DC took a less expansive approach, but now is amending their plan to get broader. So in Indiana, their agency decided to focus on families who are eligible for Healthy Families America, their home visiting program. They already serve families with risk of system involvement. It's already an evidence-based program in the clearinghouse, and they had service delivery infrastructure across the state. So being able to access Title IV-E for that work is going to give them some flexibility around TANF, which is what they used to, I think, primarily fund that work with. And then in Connecticut, their approach, I think, is similar to how this looks like it's addressed in the California plan. So they had a candidacy work group that identified 10 groups with heightened risk of out-of-home placement. And they used a very data-driven approach. And I think it's a good illustration of how FFPSA can really be leveraged to support broad groups of children and families before system involvement becomes necessary. So even that first bullet, children who are the chronic absenteeism, just that alone is 54,000 more children and families who can have access to services. So let's go to the next slide. The third lesson learned that we talk about in the brief is around the service array. So Christina was one of the collaborators on this brief with us. And in our work together, she really drove home the issue of trust, the importance of trust. And so her quote is, "It feels like the system determines what services are needed and then is prescriptive about how they're done. If there had been places my family could have gone where they felt supported and trusted to say what they needed, that would have helped us. So her quote really focuses on like the who is delivering services and the how. In terms of the what of services, and you can go to the next slide, we do need to weave together a comprehensive array of services that addresses the full range of challenges families are facing and across all the different domains. And so the social determinants of health approach from public health that Kush mentioned is sort of one way to frame that breadth of domains we need to be thinking about. I know that that language is kind of wonky. These are actually quite foundational. These are foundations of health, not just determinants of health, but this kind of any broad framework like this, it sort of drives home, I think, why the braided funding approach is so critical, because it's sort of this framework, this idea, this commitment necessitates getting beyond the currently approved evidence-based programs that are in the clearinghouse, right? We have to think about new services designed by and with tribes and communities of color. That's the opportunity here. And we know, for example, economic support is critical. It's a component of some of the approved evidence-based programs, but we know we need to go big on economic and concrete supports, and that's going to be, for now anyway, outside of FFPSA largely. So I'd say lastly on this, just keep in mind that building out this kind of array of services is also likely to require capacity building. We talked about capacity building in the community engagement section. So we can't expect all organizations to be ready to serve either as the hub or the coordination entity or as effective culturally competent service delivery partners. So building capacity is important. Okay, next slide. We also talk about the issue of infrastructure in our brief. Counties may need to build new infrastructure in order for families to access services without coming into contact with the Child Protection Agency, or you may not need to, but it's a critical question to ask, right? Because the last thing we want is for community pathways to somehow inadvertently increase surveillance of families. In the brief, we talk about both approaches. It's sort of building on existing infrastructure and then building new infrastructure. So Indiana, as I mentioned, was able to turn to their home visiting program. With that, the service delivery infrastructure already in place, then moving to implementation is less of a stretch. It does require some new tools and protocols, but can be relatively swift. Also in Washington, D.C., they had this established network of community collaboratives I mentioned, so there was some appropriate infrastructure to build upon. Connecticut, on the other hand, and I think Krista will talk more about Connecticut, they're using FFPSA to build new prevention infrastructure outside of the Child Welfare Agency. So they've created a new care management entity, and though that function is new, it does build on, like it would in California, it builds on some history of differential response and systems of care, approach to mental health. So they weren't starting from scratch. Okay, next slide. I want to just say a few things about the workforce. I think transforming child welfare systems to really focus on preventing foster care, or as you say in the California FFPSA plan, I love this language, moving the gravitational center of the system upstream, that has pretty significant implications for our workforce, both the workforce in public agencies and in community partners. So in some ways, this is about developing a new workforce. This work requires different competencies than what we've historically trained to in child protection. It's also an opportunity to rethink who provides services. Community-based agencies are going to be best positioned to connect with families and deliver many of these services, and are probably also best positioned to engage and support a workforce that represents the community and values lived expertise. So, and I think there's some creative things starting to happen related to workforce, and DC, and I think you may be doing this in California as well. DC saw FFPSA as an opportunity to really embed motivational interviewing across agencies. So the DC Child Protection Agency is now providing MI training to staff inside and outside of the agency, other public agencies, community partners, so they have a more aligned approach to case management across the city. And I mention this in the context of workforce because MI doesn't require a specific degree to implement, so expanding the reach of MI across the city has also helped really broaden the workforce pipeline in Washington. Okay, I'm almost done. I want to just stay on that idea of creativity from the last slide. Be bold, expect to iterate as you work on these plans. This is a very exciting time, really, and we are looking forward to seeing where the counties in California take this opportunity. It's not a thing like where we have perfect, well-tested strategy off the shelf to hand you and say, here's what you should implement. This is going to look different. It should look different across communities. Other folks are learning and amending their plans as they go. I think Utah has submitted a 4th amendment to the feds for their FFPSA plan. So the idea is start somewhere, but keep learning and keep iterating, and think broadly about this. The law, the FFPSA law, was pushed and broadened beyond its original goals, and we should push the community pathways concept to be broader as well. And then finally, try to stay solution focused, and don't assume that things are going to be roadblocks until you really figure out that they are. I think Krista will share some more about how states are getting creative in areas that they maybe initially thought were roadblocks, so how they approach data systems, how they define candidacy, what a child-specific prevention plan looks like. So I think we have to stay creative in this work. Okay, I think next slide. If you haven't seen it before, we have a questions from the field page on the KC website. It has links to over like 350 short publications on a range of child welfare topics. And we have several things related to community pathways, which are in your resource sheet. So I think we're going to do a Mentimeter exercise, and then we'll try to respond to some. If we have time, we'll try to respond to some of the questions in the chat. But for Mentimeter, have you guys, I think people have done this before. There's some instructions being dropped in the chat, but you're just going to scan that QR code, and we have one question we'd like you to reflect on. The question is, what is something that was shared today that connects with how your county or tribe is conceptualizing community pathways? It could be from my talk, it can be from what we heard earlier from Hillary or Dana or Kush, but what is something that's been shared today that connects with how your county or tribe is conceptualizing community pathways? And we'll take a few minutes for folks to reflect, and then we'll start to see some of those responses on the screen and do a little bit of processing together.
All right. If you haven't taken a screenshot of that QR code, hurry.
Okay. No wrong door. Family resource centers. Shifting paradigms. That's great. Blended funding. Equity. CBOs. Coordination. I love no wrong door is getting bigger. I think that means more people are saying it, which is great. Nimble. Yes, must be nimble. You're not in the conversation. So I think this is a new conversation in some communities, perhaps. And we need to think about who is not in the conversation and not at the table. Transformation. Good. Infrastructure shared responsibility. That's great. I don't think I used that phrase, but very much shared responsibility. Great. Well, I love the three that are in the middle now: collaboration, no wrong door, and transformation. I feel like that's a good note to end on. Are there any questions that I have not been tracking the chat, but that it feels like I can answer now? I think we're going to go into a lot more detail soon with the Chapin Hall presentation. So, but
yeah, there are a few, and you know, other presenters in the Chapin Hall may choose to come back to them, highlight them, but let's lift them up for now. One is sort of how have we been defining community in this context? I know it's a $1 million question in some ways, but Nicole, how would you answer that right now?
It's such a great question. And I do think that you all have to sort of answer that in your own context. I think, the approach in Washington, D.C. of having neighborhood-based community hubs that really do, they have, I think, 8 wards in Washington, D.C. and 5 community hubs. So it's not every neighborhood. There's multiple neighborhoods roll up into one of those community hubs. So I think it does depend on your context. I think the key, one distinction with the word community in this context is just that folks are coming to services at the community level in their neighborhoods and not through public agencies, and that's critical. But what geographic definitions of community are going to differ so much.
Yeah. And it's one of the things that I've seen happening a lot these days, Nicole, is having the community define the community. Stick a dry erase map up there and give them markers and say, okay, what's the community? What do you call it? And we
probably should use plural all the time because there is no one community county.
Absolutely.
I see a great comment about how the social work training in Humboldt is starting to really prepare folks with a different set of skills. That's great. I do think it's overwhelming, but this push upstream is a real opportunity, I think, to rethink workforce training.
Yeah, and it is going to be a tension. There is the regulatory aspect of the job. And there is the court side of the house and all the details and paperwork that go with that. And that can be really overwhelming. And so folks are going to have to make their own decisions around, do you have one kind of worker do both? Do you actually separate those more prevention type service provision to one kind of worker and keep the court work with another type of worker? And how that proportion works is going to have to be a decision folks start to make here soon. There's one more question. This is the question that I was holding, and I'll lift it up here and then I might lift it up again. So there's a question about EBPs and how could programs that have EBPs now, that are already providing EBPs now, be leveraged to support the community pathway, the CPP, and ultimately draw down child-specific 4E funding once our data system's capable of doing that. Is it anything to say, Nicole, right now about sort of EBPs being leveraged in this space and how folks are doing it?
Yeah, it also caught my eye. I feel like it's a really important question, and I feel like I don't quite have enough context on behind that question to answer it very well. But let's hold it, and maybe if we have time to actually have Patty.
Yeah, maybe have Patty come off mute and ask a Q&A. Okay, all right. Then let's, like Nicole mentioned, she gave us, she's zooming out a little. And setting some context and some principles. And now we're going to turn it over to our colleagues at Chapin Hall to get a little closer down to the ground, maybe 10,000 feet from our 30,000 foot view, and share with us how some of this stuff is being conceptualized across the country. Let me share my screen and get us back. All right. Hey, Krista, please go ahead.
All right, thanks, Coach. Hey, everybody. Really excited to be here alongside my friend and colleague, Jen O'Brien, to continue this conversation around community pathways. And similar to what Coach said, just want to lift up that I'm going to go back to many of the same ideas that Cole and Hillary raised and just go a bit deeper and carry that conversation forward. But before we get started, I would like to acknowledge that Chapin Hall is located on the traditional lands of the Ojibwe, Ottawa, and Potawatomi nations. Many other tribes, such as the Miami, Ho-Chunk, Menominee, Sac, and Fox, also call this area home. Our region has long been a center for Indigenous people to gather, trade, and maintain kinship ties. And today, one of the largest urban Native communities in the United States resides in Chicago. And many members of this community continue to contribute to the life of our city and celebrate their heritage, practice traditions, and care for the land and waterways. And with that, we'll get started and talk a bit about community pathways. First of all, we're going to split our time into 3 sections. The first section will really be more of an overview about what do we mean by community pathways, some of the benefits and opportunities inherent in the legislation, challenges and tensions to overcome, how that situates in some of the federal guidance that's been given, and provide a bit more context setting for what we've been discussing. Next, we're going to go a bit into some jurisdictional examples. Some of this Nicole already spoke to, but a little bit more detail about how a number of jurisdictions are conceptualizing their community pathways. And then we would hope to have some time to break out into some small groups and tackle some, some questions in a smaller group context and generate some more ideas from all of you so that we can continue to learn together. So that's terrific. Next, Coach, please. So what are community pathways? Like they're not really a thing, right? Like we're making them up and trying to think about what they mean specifically within the context of the Family First legislation. Next slide, please. As we know, there has been a really strong prevention services infrastructure that has been in place for a very long time in many jurisdictions. Children Trust Fund, the CB-CAP programs, and many of the strong community resources that already exist. What we're talking about here is specifically a community pathway in the Family First context, which is any avenue or mechanism or access point that families can use to become connected with Family First prevention services funded by Title 40 outside of the traditional child welfare paradigm, outside the traditional service delivery and case management context. And how can that look? All kinds of ways. What we've seen so far in the jurisdictional examples are trying to think about working directly with community-based agencies or other entities to be the folks that families engage with and they administer the prevention services. There are some jurisdictions like Indiana that we'll talk about later, New York as well, that are seeking to partner with specific evidence-based service providers. And maybe this goes a little bit to the question that was posed in the chat, but home visiting models are a great opportunity to build out a community pathway. And there's also jurisdictions, DC for one, that's thinking about partnering with non-child welfare public agency partners, like departments of homelessness, behavioral health, public assistance, where folks might engage with another public agency, meet the candidacy definition for their jurisdiction, and be able to access preventive services that way without ever coming through the front door of the child welfare system. Those are 3 examples for now, and I'm excited to see over the next the years that come what other options we might be considering. Next slide, please.
Krista, real quick, I might just jump in on that slide for a second, just to remind, so our California participants will recognize some of the examples Krista just mentioned when she was talking about who provides case management. As you know, the approved California Prevention Plan encourages counties to look at their existing resources within the county. And that might mean tapping into differential response processes, family resource centers, community-based organizations, or even behavioral health agencies as potential case managers. And as Hillary described them, service coordinators within your community pathway. And Coach, you even mentioned earlier that, in your opening comments, planning to implement a community pathway is really an opportunity to tap existing diversion-oriented infrastructure. So we just really want to highlight that for our California participants today.
Thanks, Jen. Appreciate that here and going forward. I'm helping me bring this down more specifically to the California context. Love that. So why do we want to do community pathways? We've already started going into some of these examples, but first and foremost, we can serve families outside of the child welfare system. Most often, despite many efforts over our years to become more trauma-informed and strengths-based, many families experience child welfare system involvement as a very traumatic, intrusive experience. And a community pathway provides us an opportunity to engage families in the prevention services outside of that context, hopefully earlier, before child welfare system involvement becomes necessary and family separation becomes an intervention on the table. Related to that, community pathways create opportunities for families to engage in prevention services voluntarily with providers they trust, in communities they trust, without direct involvement with child welfare professionals. And I go back to the quote that Nicole had shared earlier about what's more responsive to families, what might be a better service environment to help meet their needs, and community pathways allow for. We get to tap into 4E, guys. 4E is the largest child welfare funding stream that we have available. And Family First is revolutionary in the sense that it opens up Title IV funding for prevention services when IV funding has never been able to be used for services, period, even for children in foster care. In addition to that, we're funding, tapping into IV on the prevention side, which has never been done before. We've built, and I love that quote, I forget who said it, the California language about moving the gravitational center of child welfare further upstream. That's so important because we have built a foster care system. We spend $37 billion a year nationally on child welfare services. The vast majority of that go toward family separation, investigations, permanency options through adoption and guardianship. And we're only investing about 13 to 15% of resources on prevention. Community Pathways and Family First in general provides us an initial opportunity to tap into 4E and invest in families and invest in services differently and beyond. Thinking about the 4E funding for the EBP specifically, it also provides an opportunity to tap into the Title 4E administrative dollars that help us build infrastructure and capacity in community agencies and other partners to serve families. I think this is really important from an equity perspective as we think about how we have under-resourced or disinvested in communities, and this is an opportunity to build capacity and infrastructure where we don't have it, create opportunities, employment opportunities, to Nicole's point, as we think about different opportunities for workforce, and create avenues to prevention services where families are in their communities from people that they trust. Using a funding mechanism, as robust as Title 40, which is again towards that paradigm shift around strengthening community capacity to strengthen families and prevent maltreatment from occurring and prevent family separation. I think Community Pathways also gives us an opportunity to think differently about how we work, with whom we work, to think collaboratively. And not think that child welfare alone is going to solve all these problems we've known or effectively serve families. We know that we're not doing that, and that we need new partners, different partnerships, strong collaborations with lived experts, with community partners and leaders, with other public agencies to create a stronger continuum of preventive services. Jen, I think you had a couple points you wanted to make here as well.
Sure, real quick. I mean, you all raised collaboration and shared responsibility on the Menti exercise a few minutes ago. And that's exactly what this last bullet in particular is making me think about. You also have engaged in that AB 2083 and the work that you've been doing in the counties to develop memorandums of understanding, to implement a coordinated system of care with cross-sector partners. All of those efforts help ensure collaboration across child and family serving systems. And let me point out how the EBP selection in the California now approved prevention plan, so exciting, right? And your SOC work are the critical nature of partnerships between child welfare, public health, mental health. Let's think about that. Public health oftentimes in California is standing up your home-based, your home visiting programs, your EBPs. Mental health has all of those other EBPs that you've really embedded in your California plan focused on child mental health. And so by partnering with mental health and public health and collaborating through your SOC, through your community pathways, we are really providing an opportunity to strengthen those partnerships, reinforce a lot of the work you've already been doing.
Great, thanks, Jen. We thought it would be helpful also just to spend a minute or two clarifying what are the specific prevention program activities that would need to be considered when developing community pathways. So there's first the process of identifying and engaging families and determining who is eligible. Federal guidance is really explicit that the actual candidacy determination needs to be made by the Title IV agency. But all of the work leading up to that actual determination, the identifying families, the gathering the necessary information, packaging all of that up, that can be done by other partners, as long as it's transmitted and it's an actual employee of the 4E agency that's making that actual eligibility determination. There's also the process for collaborating with families to develop and monitor child-specific prevention plans that are inclusive of but not limited to the EBPs. You're thinking about holistically, what are the range of prevention services that families need to promote their well-being and Be Safe and Well. There's that set of activities. There's referring and connecting children to their Family First EPPs and providing the EPPs. Now, there can be some entities where perhaps they're doing all this work and providing the EPPs, or perhaps referring families out to another set of partners or providers that's actually providing EPPs. There's also the activities associated with conducting ongoing risk and safety assessments. Just to note that those can be formal or informal, and there's lots of flexibility in how to think about the ongoing risk and safety assessments, but it is part of the legislative requirements. Activities associated with fidelity monitoring of the evidence-based programs, as well as fulfilling all of the data reporting requirements. So as we think about the implementation of community pathways, there's all the stuff that needs to be done, but lots of flexibility about who can do it and how to think about our contracted partners and other collaborators, and to think about who's best positioned to do this and how we can leverage Family First to think about this really flexibly in new and innovative ways. Next slide, please. Just wanted to take a couple of minutes to call our attention to some of the federal guidance that has come out in recent years that's really facilitating movement toward community pathways, right? And it's been, I'm going to lean into some of the tensions in the next couple of minutes, right? So we've got the actual legislative language of Family First, and then we have the inherent flexibilities within the legislation. And one of the first things that I wanted to call out was that the Title IV agency can contract out Title IV administrative activities for these prevention services. So we can be thinking about different partners engaging families in doing this work. We've been contracting out child welfare services forever. There are jurisdictions that are wholly privatized. This has often happened on the foster care end of the continuum, but we have the same kind of flexibilities to think about contracting out those administrative activities I just talked about on the prevention side, possibly with newer, different community-based partners. And so that's a pretty important flexibility that allows us to tap into those federal resources in new and exciting ways, either through those contracts or through Title IV-E. Agreements is also another innovation. We think about different types of partners, both tribal and other public agency partners. Next slide, please. There was a recent Dear Colleague letter that came out toward the end of February that contained a bit more federal guidance about some of the flexibilities that are inherent. And this first one is really important. The question is, are Title IV agencies required to have an open child welfare case for a child that's receiving Title IV prevention services? And the answer is no. There does not need to be an open child welfare case. And this is consistent with guidance and encouragement for jurisdictions that consider going bold, going further upstream. The legislative language says that your candidates are defined as children that are identified as being at imminent risk of entering foster care, and absent provision of preventive services are likely to enter foster care. Now, that's written in the same kind of deficit-based kind of pathological language that we've seen in a lot of child welfare legislation. We recognize that, and leaders and parties have recognized that that is overly limiting. And so the Children's Bureau has opted not to further define what imminent risk means and not to define what candidacy means, and leave it up to jurisdictions to figure out who they want to serve through their Title IV prevention services, how they want to operationalize these things consistent with the goals and objectives in their Title IV plans. So that is, yes, we're working within some of this language that's in the original legislation, and we've got opportunities still to think more boldly and more innovatively and use these resources to expand access to preventive services to families that have not previously had access to these types of services. So you don't need to have a child welfare case plan. You can be receiving preventive services without being a child welfare case or considered in that way. And the second question is around communicating this whole notion of imminent risk with parents. And does the Title IV agency does Title IV require that the 4E agency or provider use language stating that the child is at imminent risk in entering foster care? And no, we don't need to say that. There are some there's some technicalities in the legislation that the case plan needs to, state that the child is meeting the definition in the state's approved Title IV plan. But there's ways we can talk about this, that there are services that are designed to meet families' needs, to address the concerns that they say that they have, that are to keep the child safe and the family well and thriving. And so it's a tension here, and I don't want to back away from the complexities. And I'm sure that folks have a lot of thoughts and concerns about it. And we've got guidance that is saying that we can think about this differently, and that it's up to jurisdictions to decide for themselves how they want to take advantage of this opportunity, consistent with the goals and objectives of your prevention plans. Next slide, please. So like to that end, right? There's a lot of benefits, there's a lot of opportunities, and there's a lot of challenges and tensions. And I just really talked about that. Like, how do we want to optimize? How do you want to, within your jurisdictions, within your counties, optimize the flexibility that's inherent within Family First, while also operating within the legislative framework and its requirements? I saw a comment to this out in the chat. I apologize, I didn't see the whole question. But this whole notion about increasing surveillance is so important. Like, how do we design these community pathways in such a way that we are increasing access to helpful prevention services that are responsive to what families say that they need, without increasing surveillance on those families or bringing families into the child welfare system that otherwise would have had no contact? And I'm not saying that's an easy thing, but that's something to be working together with partners to figure out how to work with families in this context and get them access to services without these unintended consequences. Related to that, these data requirements. Yes, there are data requirements associated with Family First, and jurisdictions are required to send certain information to the federal government, but that information can be de-identified. There's ways to think about as folks are developing their IT systems. Some states are SACWIS, they're on their way to CWIS. As I know, this is a whole can of worms that's worth its own training series, likely at some future time. But there are ways to think innovatively about prevention modules and who has access to information, where we can get the information that's required while still protecting family privacy, but it does require an awful lot of careful attention in alignment with concurrent efforts to build out state and local IT infrastructure. Similarly, and I think Nicole and others talk so much about this, is community infrastructure and capacity. This is a great opportunity, and we likely need to build a lot of infrastructure and capacity to be able to do these required activities in the way that's expected and in the way that we want to be. And we're seeing this in a lot of jurisdictions on their implementation processes, recognizing that there's a lot of work that needs to be done to build the necessary infrastructure to do this work. We've got new resources to do it, but that is something to keep in mind about all the investments that will be required to get to a place where we can implement these community pathways as we are intended to. And then related to that, do we have the services available that actually meet families' needs? It's great to set all this up, but if we develop these comprehensive child-specific prevention plans, but then the EBP isn't there, or the other services and supports aren't there in your communities, that's not going to be that helpful. So we want to make sure that we're concurrently looking at the service array and what's available, so that we're able to meet the range of families' needs that would be identified throughout these engagement processes. And Jen, over to you.
Yep, and I just want to take one moment to look at the challenges and the tensions that Krista was talking through a California lens, right? Each California county is in the process of developing their comprehensive prevention plan, or CPP, right? As required to opt into the state block grant funding. I think Hillary mentioned earlier, 5 counties have already submitted their CPPs and are being reviewed. That's fantastic. So the CPP and the state block grant funds are encouraging counties to optimize flexibility. What does that mean? What does it look like to build community infrastructure and capacity beyond the Family First evidence-based practices? To work with communities and individuals with lived expertise to identify the resources, the concrete supports, the programs that, as Krista emphasized, that meet their needs, right? So it's a combination FFPS of making sure that we are looking not just at the EBPs, but broadening our view. And the state block grant funds are allowing California counties to reach much further than the provisions of Title IV EBPs, which is fantastic. But there's a couple of things that you have to remember while doing so. Quality implementation and quality data is going to tell us so much about what works and what doesn't work with a child welfare population or child welfare community population potentially, right? And that we, in the county plans, when you look to using state block grant funds to implement the EBPs, we have to make sure that it's being done to fidelity. Your community plans to use SBG funds to provide potentially guaranteed incomes, maybe something more innovative for a vulnerable population. Again, we have to make sure that we're tracking outcomes and impact. Everything the California counties learn from their CPP implementation is going to be a value add to the rest of the nation. It's going to help other states think and continue to grow their vision for community pathways.
Great, thanks, Jen. So on this next slide would look familiar to folks that had the opportunity to take a look at the key considerations document that was circulated as part of the pre-read. We've got a resource that would consider for anybody that is thinking about or actively pursuing community pathways. We've developed a resource that outlines a bunch of key domains that have guiding questions and considerations as we think about all the different domains that are reflected on the slide that are really helpful when trying to think through the whole community pathway development and implementation process. Many of these domains are really aligned with strong implementation practice and implementation drivers. Others are very specific, to some of the family first requirements. But hopefully that guide is helpful for structuring some of the thinking and the implementation planning. I wanted to call out one specific choice point, and that is how the vision and values consideration or domain, or sorry, the vision and values domain is listed third. I think we're often inclined to do our vision and values first, but in community pathways, that's something we really want to do in partnership with all of our collaborators, with lived experts, with folks that stand to be most impacted by this work. Instead of going into this work a priori with the vision and goals predetermined, to really think about who we want to have at the table first, how to engage them, figure out your governance and teaming structure, how decisions are going to be made. Once you have that baseline, then move into vision and values in a more open, inclusive, and collaborative way, so that those decisions are made authentically with partners, rather than going into those relationships with much of that already determined, which can be often a barrier to authentic engagement. So the next slide has that resource. It was in your pre-read. We've also got it on our website. Happy to make it available, and hope it's a helpful guide as you continue to think through some of these processes. And I think that brings us to the end of the first of our three sections, Kush. Do we want to pause for a second and take any questions before we go into more of the jurisdictional examples?
Yes, I think we do. We've got quite a few building up in the chat. So I will lift them up for you. So given the pieces of a community pathway that have been mentioned, care coordination, candidacy determination, prevention planning, safety monitoring, how do you really envision a no wrong door approach? And Leslie, if there is anything else you'd like to add to your question, please feel free to come off mute and do so.
Yeah, I think I'd appreciate a few more words in that question. I also wonder if some of the jurisdictional examples about how they're doing, I'm thinking about the Connecticut entry might be a good kind of illustrative example to this question, but I also want to make sure to do the answer justice.
Okay.
So originally, when we were talking about community pathway, in my mind, I was envisioning like a place, right, or a provider providing this community pathway. But for me, that kind of flies in the face of this no wrong door idea, because I would think that you would want somebody who went to any of our, behavioral health organizations or FRCs, right, to be able to get access to this community pathway. But there are these requirements, right, of that. So I just wonder, like, how that really, like, when the rubber meets the road, what that really looks like.
Okay, let's put a pin, hang on to that, Leslie, and I'm going to go through more of the specific examples, see if it gets to it, and then let's circle back to that, like in 10 minutes. and see if some of this becomes clearer, and then we can unpack that a little bit further.
Yeah, thanks. And I mean, I don't, Krista, I don't know that there is any requirement that you can only have one community-based provider be the doorway to your services. Of course, that does mean that anyone you choose does have to, make the investment in some of the infrastructure that's going to be required to engage with the 4E agency, et cetera. But just want to say that first, and then yes, more on sort of what that looks like when you start to give the examples.
Right, because folks can directly engage with their community pathway or with your community provider, however you're conceptualizing that. There can be referred to the community provider from, say, a 211, or come from some of your other, public agency partners, or they're like, oh, you might be a real benefit for the community pathway. They can come in that way. Like there's a lot of mechanisms by which families can access a community pathway. That's going to be dependent on what are the specific choices that you'll make within your jurisdictions. But there's multiple ways to get there, which I think is some of the spirit behind the no wrong door. Even if you come in through the traditional child welfare door, there's ways that you could be stepped down into a community pathway, and we'll talk about that in just a second. So let's hang on to that, see if the next couple of minutes get more deeply into it, and then circle back for anything else that still seems unclear.
Krista, let me just add though, real quick. I mean, when the no wrong door is any of those doors that you identified, Leslie, in the county, they're going to have to work to make sure that they have those folks prepared for what little pieces of this FFPS process they have to adhere to. But I guarantee they're probably doing them. They're probably already assessing for needs when somebody comes in. They're probably already developing a plan and thinking concretely about what this family might benefit from. And so it's tapping what already might exist and thinking concretely about tweaks or modifications that might be needed to adhere to the legislation. So I think there's an ongoing process there. Sorry,
Right.
Krista.
No, great.
And then there's a couple more, and if this is also something that you're going to deal with in examples, let me know. We can move there now. But this is a conversation. This is a question I hear a lot, which is, so are there liability concerns for those entities that are outside the traditional child welfare system? And Jane, if you'd like to come up, there's an analogy you're making about the neighborhood helper or the corner store owner. Feel free to come off on mute. But this question of like, okay, so where does now the liability live if a provider is doing the assessment, the safety and risk monitoring, and something goes wrong, right?
Yeah, if we're talking about community, it's so much of what we speak to our organizational context, as opposed to those people in community who are probably know best, or I'll say neighborhood, not community, who know best the people who are living there. The person who's hungry and the kids are at risk because they can't get enough food and get referred to. And that owner of that little grocery store does something and keeps people going. It seems to me that while FFPSA is indeed a great move, I'm very appreciative that they're doing it. I've been in the system for quite a while now. And I'm wondering, prevention to me means not getting in there in the first place. Mm-hmm. And the people in the neighborhoods know who the people are at risk. And so, if you help and then your neighbor gets angry with you and decides to do a little bit of law stuff, I don't know. I don't know how we do it. But I think we need to consider that in terms of the folks that are indeed out there who want to help the people that live next door. So I don't know if that makes it any clearer to you. When I was in Philadelphia a number of years ago, we had some outposts in communities, and California is really different in terms of what neighborhoods look like. So I don't know that I can compare California to Philadelphia, Pennsylvania, but it seemed to me that there were a lot of contacts with people who were worried about their neighbors and the kids in their neighborhood. So that's all I'm really trying to say is let's really make it prevention.
Mhm.
I really appreciate what you're raising, Jane, and there's a lot of complexity and important points inherent in what you said. I'm not going to pretend like I know the through line or the right answer to everything, but I want to lift up a couple of things that I heard in your remarks, offer some observations, and welcome the input from Jen and everyone else on the phone that might have another take. Right, where to start? So this is not what you said directly, but one of the things I was hearing in your comments was like, how do people help? And then to that, I think about the mandated reporter laws. I know that's not exactly what you're talking about, but this concurrent conversation around mandated reporting versus mandated supporting, and what are the options that people have to help families that they observe to be in need of some kind of services or support. And we've created one real option, and that is the hotline. And there's a lot of effort right now to try to think about what are alternatives that are more responsive to what families need, because perhaps a child welfare investigation is not going to be the most responsive and helpful answer, but there's not a lot of other opportunities that are there, and folks are starting to think about how to do that differently. The community pathway, and this is reflected in Connecticut and others, is like, is there another option? Like, if somebody observes, whether they're a mandated reporter or Mr. Jones at the corner store, observes that there's a family that's in need of some services or support, there's not an immediate danger to the child's safety. Then maybe the family needs food, or maybe the family needs clothing, or the family needs help with their housing stability, or whatever's going on. Can they be referred to another entity like the community provider that can step in and provide more responsive services to the family? How will the family take it? It's like, hey, here's a referral, or maybe this family resource center could be helpful to you. Certainly there can be some challenging dynamics when folks are maybe offering help where maybe it might not be wanted. But I think one of the benefits of community pathways is to create mechanisms for families to be directed to another place that's not the traditional child welfare response, but in fact might be much more comprehensively responsive to what the families actually need without needing to go through that child welfare experience. That's the first thing that I'm thinking about. I'm not sure if that's totally getting at what you're saying, but at least trying to create a different environment where there's other ways to help families and to build that infrastructure and to create mechanisms to prevention services that look different from what we have traditionally done. Does that help or not at all?
But I thank you for your response. I think these are discussions that we really need to have in terms of thinking about how we are responding to children and their families. California has been doing some incredible work that's been going on for over 30 years, and the paradigm shift that I see happening here is a very positive one, but we are still in our silos and not having as much communication across systems as we need. And we don't know our communities in terms of really understanding. So I think having maybe a little more flexibility in the system, the ability to talk to people and be able to hear what's happening, really happening, why, without making judgment. And we're so task oriented that we forget we're dealing with people whose task and ways of operating may be just a little different than our own. So thank you for the opportunity to spill my gut.
And this is complex work, and we need to talk through all of these issues to really co-design what these pathways to prevention services could look like, especially since we're trying to create a world that looks vastly different than the one that we have. Kush, I wonder, do we want to do more questions? Do we want to keep going in the interest of time? Or
I think one more. I think one more, because it's sort of the next breath in some ways of the discussion you're having, which is the concern around over surveillance, right? So, okay, so now the child welfare or the probation worker, whoever that is, has to do candidacy determination, right? To turn on the spigot for funding, so to speak. And that's going to require a name or some identifier, right? How do we prevent our current concerns around over surveillance? How do we not bring those into this prevention world? Is it possible to completely have a family identifying information be blind to the 4E agency? What have you seen? What are your thoughts?
The one that the example that I can speak to most specifically, just transparently, is because I'm working most closely with Connecticut. It's where I have the most direct line. How we're thinking about that is there's a provider information exchange that's outside of the state child welfare system that has a lot of the data that's from the providers with whom the state works. That's where the information is going to be located. The required data elements are transmitted to the Children's Bureau. And when we're thinking about the claiming and being able to match, who are the families that are receiving the prevention services, that information is being limited to 3 people in the whole state that have access to that information, so that they are able to, match and be able to generate the claims. But it's not wide open to everybody. So I think there's ways of thinking about, and admittedly, I am not an IT expert, so I can talk for about 30 seconds before I get myself into trouble. So I just want to own that. I think there's ways to think about prevention modules and keeping the prevention family information required elements outside of the child welfare system where that's protected, to be thinking only about sending the required information specifically to the people that need it, limiting access to people that don't need it, and clarifying that information that's collected for purposes of prevention services does not necessarily mean that the families in the child welfare system or the database, that you can keep all of that separate. And I welcome anybody, Jen or others, that maybe have more facility in this area to add or amend any of that.
Yeah, and I put in the chat what is 4E claimable information that is required. And the most specific gets to the date of birth of a child, right? So that you can track. And as Krista said, the state on the side of firewalls is making sure that there's limited access to the information, but it's not requiring names. It's not requiring addresses. It's not requiring social security numbers. It is really going back to which child, date of birth, received services and for how long did they receive the services and what did they receive? And then tracking whether or not that child with a unique identifier that's only seen by a few, right, that firewall, ever comes into foster care. So we can put in the technical bulletin that outlines what the required fields are, just so you have that as a reference. I'll pop it in. But please recognize, I think it's federally trying to avoid the surveillance, trying to avoid the required information being a whole nother repository of families' individual information.
Great, thank you. And then there's another question that we think is going to be answered more in the Connecticut example. So let's move forward, and then, like you said, Krista, we can circle back around.
Thank you.
Okay, here we go.
All right, let's go right ahead to the next one, and we'll be building off of some of the information that Nicole provided as well. So this is sort of how do we get to a community pathway? Lots of different ways. There's jurisdictions that are thinking about providing access to preventive services before there's any child welfare system involvement whatsoever, and obviating that that whole child welfare. Then there's ways to think about after a call to the hotline or a closed CPS investigation. Maybe a hotline call was made, it didn't meet the criteria for investigation or differential response, but the information signaled that the family might benefit from prevention services, or there was an investigation, it closed, but there was no need for a formal ongoing child welfare system involvement, but circumstances identified that suggest that families could benefit from ongoing prevention services. So it could go that way. Also, you could think about access to prevention services in communities after a child welfare case is closed. So if we think about once reunification is achieved, or perhaps a guardianship is finalized, but the family would benefit from some ongoing support, some of the evidence-based programs would still fit their need. We could think about this as a post-permanency intervention as well. So it's kind of, we take that child welfare continuum, which we think of as a line, and we turn it into a circle, because many of these prevention services can be used to prevent reentry or repeat maltreatment and so that's another way that we're thinking about it. A number of states are thinking about applying the community pathway in that way as well. Next slide, please. So the first example is Washington, D.C. Nicole talked a little bit about this. D.C. has got a really long history and a strong infrastructure in community-based providers. The Healthy Families Thriving Communities Collaboratives, or the community collaboratives, are the place where DC is leaning into this at first. They've got a couple different ideas. One that without child welfare involvement, thinking about children that are born with a positive tox screen, that's still in development. Where they're really doing the work right now is really capitalizing on the relationships and infrastructure that they've got with their community collaboratives after the CPS investigation or after the in-home case with the Child and Family Services Agency, or CFSA, is closed. Next slide, please. The EVPs that DC has in their plan are parents as teachers, a home visiting model, as well as motivational interviewing. We've talked a bit about MI earlier today. They're using it as a cross-cutting case management service, which means that everybody that's a candidate is getting MI, which is really helpful for ensuring that all of the families that meet their candidacy definition are eligible for an evidence-based program, because everybody's getting MI, which is a really great strategy for thinking about quality practice, and also a good financial strategy for maximizing the resources available in Title 40. Next slide, please. As I said, where they're implementing currently is really building off of their community collaborative infrastructure. That looks through two ways. Families can get stepped down immediately following their investigation and engage with the community collaboratives for ongoing preventive services. Also, after an open case, they close the formal in-home case, and then they continue preventive services in the community collaboratives. I think that's a really important kind of meta consideration, because oftentimes the formal child welfare cases, and I'm talking about ones that have gone through the front door of child welfare initially, the service duration are often short time periods. Differential response case service episodes from 45 to 60 days or 90 days, or in-home services that are often open for 90 days, 120 days. But that's incongruent with some of the models that are on the Title 40 evidence, or the Title 40 clearinghouse, where you have home visiting models that may go for a year or better. And so how do we reconcile that? And we don't want families to be involved in formal child welfare even 1 minute longer than they need to be, but then you wouldn't want to disrupt the preventive services that they're receiving before it's appropriate to do so. A community pathway can be a way to support people that do enter through the front door of child welfare, go through that relationship to the extent that it's needed, but then step down to a community provider where they can still continue to receive the helpful, beneficial preventive services without maintaining an open child welfare case for any longer than they need to. So I think that's a consideration that we haven't heard as many people talking explicitly about, but I think it'd be really helpful, especially we consider the not wanting families to be involved with child welfare longer, the workforce considerations that child welfare agencies are facing. This is a way to keep families, or help families get the services that they need outside of that context. Next slide, please. Indiana's been mentioned a number of times. They're a little ahead of the game and are doing some really exciting work in partnership with their Healthy Families America partnerships. And so they're focusing specifically on working with their HFA as an evidence-based service provider to be the folks that are administering the community pathway, taking responsibility for all of those administrative activities. And that can happen without any child welfare system involvement, or it can happen after child welfare system involvement is closed. But the Healthy Families partners are absorbing all of those preventive services responsibilities, both the administration and the actual administering of the EBP as the home visitors. Next slide, please. And so it is specifically the Healthy Families program within their prevention plan that they're using for their community pathway, and all families that are eligible for Healthy Families are categorically candidates within their approved population. So that works out really seamlessly. Next slide, please. And whereas we go back to think about some of those requirements, like the assessments, the service plans, all of that we talked about earlier, Indiana is able to use the infrastructure that already exists within Healthy Families America to meet all of those requirements. The Family Resilience and Opportunity for Growth, or the FROG scale, I can't get over it. I love it. The FROG scale is what's used to assess families and to further risk and safety monitoring. It's the actual service plan that's developed within HFI that is acting as the child-specific prevention plan. So they're just using all the infrastructure and then meeting the federal requirements that way. So we're not having to create something new or do something new. And it works really well within the service delivery paradigm of Healthy Families. Next slide, please. And I think back to the how do we get here conversation, there can be a referral directly from DCS if the family comes through that door. If the family hears about it, and they can opt in to Healthy Families. Or there could be other community providers, other public agencies, anybody the family interacts with that recognize that they might be a good candidate for Healthy Families, could refer them in. So there's no need to go through the formal child welfare agency. You can, but there's a lot of other mechanisms that that family could be connected with Healthy Families and then receive Family First prevention services through that doorway. Next slide, please. New York is also another jurisdiction to keep an eye on. They've had the most, their implementation is furthest, also almost identical to the Indiana approach through their Healthy Families model. They're also thinking about, and this is a future implementation, to think about how to work outside of the paradigm of the child welfare agency directly with a community-based service provider. And there's also a real commitment to address economic and concrete support needs of families. And they have a concurrent, I think I saw my friend Nicole put it in the chat earlier, the mandated reporting reforms that they're doing. All of these things are happening in concert with one another. I'm trying to think about New York's really being innovative, thinking about how do we reform mandated reporting laws, how do we increase access to economic and concrete supports, and how do we leverage the community pathways to get there. Much of this is still in development, but it's going to be really exciting to see where these innovations go. And in the meantime, making great progress with their home visiting partners, very much in the same vein that Indiana is as well. Next slide, please. Yes, with Healthy Families right now, same thing, about being the EBP that's being used right now in the community pathway context. And Connecticut, and right, admittedly, the state that I know the best and have had the pleasure of working with for the last couple of years, as Nicole lifted up earlier, really broad candidacy definition that's in their approved plan. You can see on the slide all the different categories. We talked about them earlier, but as you can know, the state is really looking to think about how they can extend access to preventive services through a lot more people than have traditionally been able to receive them. Next slide, please. These are the 7 evidence-based programs that are in their approved Title IV prevention plan. At this point, it's intended that any of these programs could be made available to families who enter through the community pathway. We are still in the installation process. Technically, we're in installation, moving into initial implementation. But we're thinking that any of these 7 models will be available to families that enter through the community pathway door. Next slide, please. And similar to New York and other jurisdictions, the goal within the goals and objectives of their prevention plan is try to serve as many families upstream as possible to prevent ongoing involvement, future maltreatment, future family separation. And the way they're thinking about doing this is contracting with what they're calling a community management entity, or the CME. Is care management entity. I think I got a typo on my slide. Called the CME. That is going to be a network of agencies across the state that are going to be the access point for families going through the community pathway. They can be referred. We'll also the visual that shows how folks will get referred in just a minute. It is the CME that's responsible for engaging the family on that initial assessment, gathering all the candidacy information, doing all of that initial safety and risk strengths and needs assessment, transmitting the required eligibility information to the 4A agency, who would make the final 4A determination as is required. But then all of the work associated with engaging the family, developing the child-specific prevention plan, the referral and the monitoring, all of that is going to live in the care management entity. We are very close to having the contract finalized and can announce who our new partner is going to be. Very exciting in the weeks to come, and really excited to move in this direction. I think the next slide will be helpful. There's a little bit of animation here, Kush, if you could just click through it, of how Connecticut is thinking about folks accessing the care management entity. And I think there's some real interesting sides to the story. So these boxes all across the top: family, healthcare, sister agencies, schools, first responders, et cetera. These are our referral sources. Oftentimes the ones that are calling the care line. The care line is Connecticut's hotline, to clarify language. Families are going to be able to get referred from these referral sources directly to the care management entity. Or if families are calling 211, Connecticut has a pretty robust 211 system. And if the 211 folks feel like the families are a good candidate for the CME, they can be directly referred to the CME from 211. We're starting with engagement with schools. In Connecticut, like many other places, teachers, highest referral sources. Also, the folks that most likely have the highest number of cases or calls that are not accepted and not substantiated. And so there's going to be targeted engagement efforts to think about whether a call to the hotline is the right response for families, or if a direct referral to the care management entity might be the most appropriate response for families. And so we'll be working with teachers and then other referral sources around an engagement and education campaign to really strengthen the referral pathways to the CME. Now the care line has a dotted line to the CME because there's not going to be a direct referral from the hotline to the care management entity. Why? Well, think about it. So a mandated reporter calls the hotline, the call is not accepted. So they can't very well refer the family directly to the CME, who may not even know that the call ever occurred. And so not trying to increase that kind of surveillance or communication with families. What Connecticut's going to do is send a letter to the mandated reporter. Thank you for your call, because we're not encouraging anybody not to call if they have a concern. Thank you for your call. Your call is not accepted. But that doesn't meet the criteria, for a child protective services response. However, it seems like your family might benefit from this care management entity, and put it in give the referral source an opportunity to connect families to the CME kind of indirectly. And so that's why there's that dotted line there. And so I think there'll be lots to learn over the next couple of years as we engage with mandated reporters, as we see how this rolls out and see how this actually works out in practice. But we're getting real close to rolling this out. Next slide, please. And with that, I'll turn it over to my friend Jen to talk a bit about Rhode Island.
Sure, thanks, Krista. So I realize we're getting short on time, so I will try to move quickly through this so we can get to questions and answers. But this is a jurisdiction I've been working with for a number of years as well. And I think they're also unique in the fact that their prevention plan was just approved this past fall, but they have a community pathway that has been in place since 2009. It was established as a partnership between the Rhode Island Department of Children, Youth, and Families, DCYF, and their Department of Health to offer prevention services through what's called a Family Community Care Partnership, or FCCP. They provide an array of primary and secondary prevention services. You'll see them all depicted here on the slide. And just know that they are the primary contractor and source for home visiting well-supported programming in the state of Rhode Island. So they already have that set up. Families can self-refer or be referred by DCYF or another community-based organization. And because the program has been in place for 14 years, they have data tracking the percent of families that become involved with child welfare following completion of services. They've been able to maintain this no surveillance. While DCYF has access to information, they don't typically become involved with these families. You see the rate there of like 3%. Okay, let's look at the next slide. So as I mentioned on the last slide, DCYF can refer families to the FCCP. Specifically, they have a support and response unit that kind of triages all cases, deciding which ones will need an investigation and which ones can be referred directly to the FCCP for services. So think about that, fitting within your hotline potential structure or whatever you have. The FCCP also provides services for families at risk of disruption, post-guardianship, post-reunification, post-adoption, right? So they have that also pathway for that other candidate population. Okay, last slide. So these are all of the EBPs in green that Rhode Island is including within their community pathway. You'll notice those home visiting EBPs that many of us are looking to. Healthy Families America, Krista talked about with Indiana and New York. Parents as Teachers, Nurse Family Partnership. Those are not included on this slide because the FCCP already has them in place and is already drawing down federal funding. So they didn't include them in their Title IV plan. They're really looking to move forward with the interventions that are in green. And again, many of these are infrastructures they can already tap within Rhode Island. So I thought that they would be another great population for you to consider and think through, what their model looks like and see if there's some ideas that you want to steal shamelessly as you continue through your community pathway planning. Okay, Kush, I might hand it right back over to you.
Yep. And so we did have we had in our back pocket, should we have time, a breakout discussion. They're great questions. And I'll show you the question slide. We're not going to go to breakouts. So those of you that run away when breakouts come, don't go. So these are questions that we invite you to take back to your teams. I'll keep them up. But really, I'm going to open it up to questions now, since we have our colleagues here who are experts. So let me just go ahead and open it up for questions. And we'll end after we can answer as many as possible in 3 minutes. Okay, so for those of you that did ask questions earlier, particularly around no wrong door, and there was one question. Let me see if I can find it. Cindy, that you raised about what does that support the idea of differential response without an ROI is referring to the community pathway. Did that get answered, or Cindy, do you want to come off and answer and ask the question again?
I don't know if I want to ask the question again. It was kind of in response to the chat notation that was made above my chat. So sorry.
Okay. No worries. No worries. Just want to make sure we circle back to it. Other questions? Raise your hand. Feel free to raise your electronic hand and ask questions that way. I'm going to stop sharing. I'm not seeing any. My chat is a little stacked though. So Jessica, if you see anything, do you see anything? Or I'll just turn it back over to you to bring us home if you don't.
So there's been a survey link dropped into the chat. So thank you all for being with us. There is going to be 2 quick notes. The first is there is a survey and certificate available for today's session. You can click that link in the chat to access the brief survey and then receive your certificate of attendance. As well as remember that there'll be a part 2, the building the community pathways, and the link to register will also be in the chat. So thank you all so much for joining, and we'll see you next time.